Mandatory face mask bylaws are now in effect in Toronto and Ottawa. People will now be required to wear them when they're in public spaces indoors, like stores, for example. Other Toronto area cities are bringing in similar bylaws. Kingston's been doing it. Montreal's mayor is also promising to have a mandatory face mask law in place by the end of this month. Joining us this morning to talk about the new mandatory policy is Dr. Isaac Bogosh. He's an infectious disease specialist at Toronto General Hospital. We've reached him in Toronto. Great to see you this morning. Hello.
Hi, good to see you as well.
Okay, so masks becoming mandatory in public spaces. We know a lot of people have been already of their own volition minding some of the advice to wear the masks, but now it's a bylaw. What impact do you think that'll have on community spread?
Certainly, I think, as we've known, if people wear masks, they can prevent the transmission of this infection to others. The recommendations are, put a mask on when you go inside. It's because we know transmission of this infection is much more significant in indoor environments. And prior to today, that was a strong recommendation. And, depending on where you were in the country or where you're walking around in the city of Toronto or in other parts of Ontario, you'd see varying degrees of adherence to that. But today, I guess there's no ambiguity. You've got to do it. It's the mandate comes into effect today in Toronto, and I think, as you mentioned, in Ottawa. And it's not really a choice anymore. You've got to put a mask on. So I think people should really remember before they leave the house to have a mask with them. Put it by your keys, put it in your glove box, just put it by the front door. And when you leave the house, it's just a good reminder to have one to have in your back pocket. So if you're going into a place like a coffee shop or a restaurant, put it on.
Yeah, good idea. We spoke to a store owner last hour, and she said she does have some masks for those who may forget, but good idea to have a stock of your own. Now, face shields I want to ask you about. The plastic shields are not allowed under these bylaws, and I believe I've heard you say that you're a big fan of those. Why do you think those aren't included in this?
Yeah, I'm not entirely sure. I think if we actually look back and we look at data, there's not a lot of data that supports face shields. And the reason there's not a lot of data that supports it is because there clearly haven't been any studies that really look at it. But I think from a practical standpoint, it makes a lot of sense. They cover the face, they cover the eyes, nose, and mouth, and they're more comfortable to wear, especially when it's hot outside. There's also the added value of verbal and nonverbal communication. It's just easier to talk and smile when you're wearing one of those. I think for people that have, there's going to be some people that have some medical reasons why they cannot wear a mask. There's probably not going to be a significant number of individuals in that cohort, but there certainly will be people who just can't wear a mask for a variety of reasons. And I think a face shield in those settings would be a completely acceptable alternative. I think we're going to see more and more of those, and I would be shocked if store owners or businesses put up a fight if someone's trying to walk into their store with a face shield on. I mean, people are clearly doing the right thing to keep themselves and to keep other people safe, and I think that would be completely acceptable. So I really hope we don't see any conflict with that.
We're seeing new measures in parts of the country today. Nova Scotia announcing stricter measures to ensure people from outside Atlantic Canada adhere to self-isolation requirements. And this is, of course, just days after that Atlantic bubble opened up. And this is so people entering the province from outside the bubble. Are these stricter measures a good idea in your opinion?
Yeah, well, they really expanded this Atlantic bubble to include all of the Atlantic provinces. So if you're in the Atlantic provinces, you can move between the provinces freely because there's just such a low burden of infection in those provinces. Now, of course, as you point out, it's not zero infection. There was this small outbreak in Prince Edward Island that we're still trying to see what the full impact of that is. But I really think if you want to preserve the integrity of the bubble, and in this case it's the Atlantic bubble, you have to be very careful about who comes into that bubble, and you've got to be very careful that they adhere to the self-isolation protocols that are in place. And, quite frankly, that's how this infection in PEI started. That's how that small outbreak started. Someone came in from outside of the bubble with this infection and transmitted it to other people. So I'm all for it. If you're going to expand the freedoms within that bubble, you've got to make sure that the bubble is as airtight as it can be and ensure that people adhere to the measures so that they don't bring infection in.
In Ontario, as you know, the last holdout, the last region that was still stuck in stage 1, and that's Leamington and Kingsville down in the Windsor area, are now entering stage 2 today. So that means the whole province is in stage 2. So I want to ask you about the next rung on the ladder. Yeah, no kidding, because we know the whole province had to get there before it could go to stage 3. What now has to happen before we see the 3?
Yeah, this is going to be very interesting to watch how this unfolds, because certainly we know the province it's a huge place, and some areas have very little infection. Other places have more infection. I'm hesitant to say a lot because, quite frankly, even in the hot spots in Ontario, it's still under pretty good control. But of course, we all have to be aware that this virus has not gone away. If we let our guard down, it will come back. So we still have to adhere to public health measures. Now, I'm going to be very curious to see if phase 3 is going to be regional, like stage 1 to stage 2 was. I think that probably makes sense. And I think we also have to remember that even though particular areas could be doing extraordinarily well and have 0 to few cases, it's still possible to introduce cases to that area and to have an outbreak. Kingston, Ontario was the classic example. They were doing so well, and then there was this outbreak associated with the nail salon business. So the key things to remember are that regardless of what stage of reopening we're in, we are always at risk of having this infection. We still have to adhere to public health measures like physical distancing, hand hygiene, and putting on a mask when you're going into an indoor setting. And with these added freedoms still come tremendous responsibility on behalf of the citizens to adhere to those public health measures, on behalf of businesses to ensure safety for their employees and their customers, and on behalf of the government and public health units to really provide adequate public health care and clinical care if we need it. And if everyone does their part, we can continue to reopen safely. If there's a breakdown anywhere in that system, we're going to see cases pop up.
Always great to get your insights. Thanks, Dr. Bogosh.
Anytime.